Welcome to IPRAT's Infection Prevention module on bloodborne pathogens and sharp safety. The learning objectives for this module includes to define bloodborne pathogens, to define who is at most risk of injury, how to describe how to prevent sharps injuries and other exposures, to discuss infection prevention strategies as they apply to medication administration. Lastly, to discuss the employee's role in preventing exposure to bloodborne pathogens. CDC estimates that more than 385,000 injuries with contaminated devices and other sharps devices occur annually among healthcare personnel. That's over 1,000 injuries per day. Injuries with contaminated needles and other sharp devices are an important concern because they pose the risk of transmission of bloodborne viruses. When an employee reports a mucocutaneous splash or splatter of blood or body fluid to the face, which includes eyes, nose, or mouth, less than 3% are wearing face protection, including eye protection, face shields, masks, or respirators. 50% of these exposures are to the eyes. These injuries and exposures are costly to personnel and to the healthcare system. So what are bloodborne pathogens? They are infectious microorganisms in human blood that can cause serious or fatal infections. There are more than 20 bloodborne pathogens that can cause infection. The pathogens that may cause the most serious health risks include hepatitis B or HBV, hepatitis C or HCV, or human immunodeficiency virus, which is HIV. HBV vaccination is recommended for all healthcare workers. HBV vaccine has proved highly effective in preventing infection in workers exposed to HBV. However, no vaccine exists to prevent HCV or HIV. Given the rise of aging populations of patients accessing healthcare with active hepatitis B, hepatitis C, HIV, and co-infections with one or more of these viruses, the risks faced by healthcare workers are more significant than ever. According to the CDC, nurses continue to have the greatest number of needle stick injuries. It is important to note that 25% of injuries occur in staff not involved in the original sharps use, such as clinical team members, environmental services, personnel, waste hauler, and laundry workers. That is why it is so important to make sure that sharps are disposed of properly immediately after use. CDC reports that 27% of injuries are caused by disposable syringes. Of these, 20% were caused by 24 out of 25 gauge needles. 18.3% are caused from insulin syringes. 35% of injuries occur during sharps cleanup and disposal after a procedure, 28% while manipulating needles in the patient, 10% colliding with the coworker, 6% recapping the needle. During a procedure that involves the use of needles and other sharps devices, you should maintain a visual contact with the procedure site and location of sharps at all times. Be aware of other staff in the immediate environment. Take steps to control the location of sharps to avoid injury to yourself and other staff. Do not hand pass exposed sharps from one person to another. If using an engineered sharps injury prevention device, activate the safety feature as the procedure is being completed. Observe for audible or visual cues that the feature is locked into place. Do not bend or break needles, and never recap needles. Watch for sharps in linens, beds, on the floor, on tables, and in waste containers. During cleanup following a procedure, you should be accountable for sharps that you use. You should dispose of any sharp object that you personally use. Visually inspect procedure trays or other surfaces, including patient beds, containing waste materials for exposed sharps used during a procedure before handling them. Look for sharps that may have been left inadvertently after a procedure. Visually inspect the sharps container for hazards caused by spilling over or overfilling. You should also make sure the sharps container being used is large enough to accommodate the entire device. Keep your hands behind the tip of any sharps. Avoid bringing the hands close to the opening of a sharps container. Never place hands or fingers into a container to facilitate disposal of a device. If you are disposing of sharps with attached tubing, such as a wing-stilled or butterfly needle, be aware that the tubing can recoil and lead to injury. Be sure to maintain control of the tubing as well as the needle when disposing of the device. Insulin pens containing multiple doses of insulin are meant for use on a single person only and should never be used for more than one person, even when the needle is changed. They should be clearly labeled with the person's name and other identifying information to ensure that the correct pen is used only for the correct individual. If reuse is identified, exposed persons should be promptly notified, offered appropriate follow-up, including bloodborne pathogen testing. Lancets are fingerstick devices that are meant for single-person use only. CDC recommends the use of single-use auto-disabling fingerstick devices in settings where assisted blood glucose monitoring is performed. Reusable fingerstick devices are appropriate for individuals who perform all types of testings themselves. Never administer medications from the same syringe to more than one patient, even if the needle is changed or you are injecting through an intervening length of IV tubing. Do not enter a medication vial, bag, or bottle with a used syringe or needle. Never use medications packaged as single dose or single use for more than one patient. This includes ampules, bags, and bottles of intravenous solutions. Always use aseptic technique when preparing and administering injections. When using disposable razors, used razors should be considered contaminated and be disposed of in sharps containers. Eye drop vials should never be used for more than one patient. Take care not to touch the eye to avoid contamination of the vial. Dispense amount of single application of an ointment into a medicine cup rather than taking the whole bottle or jar into the patient room. In conclusion, you might ask, what is your responsibility in bloodborne pathogens and sharp safety? First step is, you should always employ universal or standard precautions when working within your facility. It is an approach to infection control that treats all blood and body fluids as if they contain bloodborne pathogens. This includes performing hand hygiene and the use of appropriate personal protective equipment. You should always wear PPE to prevent exposure on the task based on the task you're performing and the status of the patient. You might ask yourself, is the patient in isolation? What are they in isolation for? For example, isolation for C. difficile calls for different precautions than influenza. What contact will you have with the patient? Assisting a resident in the bathroom presents a different risk than taking vital signs. You should also participate in training when available. It can include facility-based training or modules from MyTrain or CDC Train and/or in-servicing on new devices. Become familiar with your facility's bloodborne pathogen plan. This includes your facility's policies on what tasks the facility leadership has evaluated to pose a risk and what protections are in place, and what to do in the event of an exposure. Utilize items that are needleless as well as those that have safety mechanisms that were chosen by your facility leadership to provide protection from exposure. By participating in the selection of safety devices, you can help ensure that a device meets the needs of the end users. And by all means, let your facility leadership know when you see any concerns that can lead to exposure. This can include such things as finding sharps containers overfilled, gowns or gloves that tear easily with use. The occurrence of sharps injury should not receive a punitive response, but rather should be used to identify gaps in process that lead to injury. In addition to ensuring that you get proper treatment and follow-up, data related to the how and what and when of exposure experienced by healthcare workers aids in process improvement. Lastly, get vaccinated. Vaccination against bloodborne pathogens where vaccination exists, such as hepatitis B, remains the most effective way to prevent infection. This concludes IPRAT's Infection Prevention Module on bloodborne pathogens and sharp safety. Should you have any questions about this presentation, please contact us at MDHHS-IPRAT@michigan.gov. Thank you for your time.